Thanks for joining us for another edition of Web Chats. I'm Sabrina Storm. Joining me in studio today is Warden David Mayberry. Thanks so much for taking time out of your schedule today. Let's first talk about a big merger that's happened, and you're going to be part of this as well.
So, yes, the Oxford County Board of Health or Public Health Unit and the Elgin St. Thomas Public Health Unit will be merging on May 1st. The province announced that officially, that the two will be brought together. And so we're now very busily trying to get all of the little pieces put together and things that you don't really think about around something as simple as payroll or the IT systems or the telephone systems all have to be merged together so that they work seamlessly. So staff are busy doing that. At the municipal or at the council level, with the new Board of Health, then you need a new health board. So with the merger, we need a new health board. And so Elgin has appointed two representatives from Elgin County, two representatives from St. Thomas, and Oxford County appoints four. So at our last council meeting, we appointed four reps from County Council to sit on the board. And then eventually the province will name some people as an order in council to appoint public representatives. And we'll actually be going through a process to make recommendations to the province about who we think would be appropriate people to help kind of make sure that we represent the whole of the community with the public representatives as well.
Some familiar names that will be joining you, Larry Martin, Sandra Talbot, Margaret Lupton, so you're in good company.
Yes, I think Council chose Warden and Deputy Warden, and then to kind of have some gender balance, Councillor Talbot and Councillor Lupton. Councillor Talbot, of course, has sat on the transition team, so she's been part of the process for the last few months, sort of getting kind of the pre-work done that gets us ready to do sort of the real work. The board will begin meeting. In fact, they meet May 1st at 6 o'clock in the evening to start their first sort of official meeting, which will then be, they'll sort of transition to how do you make the policies and procedures that fit the needs. You're taking two separate entities and making them one. How do you make sure that all the policies and procedures actually fit the needs of the community? And that's really what a public health unit is about, is how do we take care of the public health needs of the community, whether that be in protection or prevention. We want to make sure that we're there where we're supposed to be, and that we fit also not just the needs of the people, but sort of some of the political needs about what are we going to do about our initiative around poverty reduction and things like that, which is obviously a big issue for public health.
Lastly, on this topic, how will a merger like this affect the public?
So the public hopefully will see a very seamless, in fact, they probably won't notice any different other than, May 1st, there might be a slightly different logo on the person's jacket or shirt or whatever. But other than that, hopefully any kind of changes will be slow and gradual over the period of transition. And there'll be, I suspect, some very slight changes, as we proceed. But for the everyday services, certainly on May 1st, nobody will notice any real change. And that's good. Like we're not looking to disrupt anybody's lives. We're looking to sort of say, how do we build on the strengths of the day for the future?
I lied. One more question: will there be any additional jobs, or will there be any job cuts?
Well, probably and immediately there'll be probably really no job increase or decrease, other than at Oxford County, both our CAO for public health and our medical officer of health have both announced. In fact, the medical officer of health will retire the end of April, and the CAO for public health will retire in May. So they're not really job losses. This is just a way to take, as we move forward, those positions should be held by someone else. But it's sort of part of the transition, and it's one of the reasons why this becomes so timely for Oxford. It probably wasn't a big issue for Elgin St. Thomas, but it was for Oxford. Are we going to go one direction or another? And this seemed like the best direction for everyone, particularly in the times that we're in. So I'm actually quite pleased to see it moving forward.
Okay, let's talk EMS services. We've got a new master plan in place now.
So over the past couple of years, we've been looking at how do we improve the emergency, the ambulance service across the county. And The challenge is, and it isn't everywhere, is that as the population ages, older people tend to use ambulances more often than others, and so as our population ages, gradually, then we've seen the increase in number of call volumes. The system that we set up 10 years ago, where you have ambulances in different stations, and then we realized a few years ago that we were having too long of a response time in the Drumbo area, so we included or added the Drumbo station. We're now finding that if we need to actually quite often bring in the Drumbo or the Embro, whatever ambulance, into Woodstock because of the call volume in Woodstock, and we're now leaving Drumbo in particular, Drumbo a little bit short again. And so it's kind of the natural evolution, and I think that people will say, well, we have really, and we have excellent response times in the urban areas. We're a little concerned that our response times in the urban areas are sort of starting to drift, in the rural areas are starting to drift back to where they were a few years ago. And so the plan over the next 2 or 3 years will be to kind of beef up the urban area so that the rural ambulances can actually stay where they belong. And we're going to start by adding a couple of full-time staff we did already this year, but a couple more into the Tillsonburg area, so that they'll have 2 full-time ambulances 24 hours a day, 7 days a week. And I think that's one of the starts. And then eventually, as we move forward, we're going to have to be looking fairly seriously in the next year or two about what we're going to do in Woodstock to kind of beef up the ambulance service here so that the rurals aren't always sort of running in. And you don't want an ambulance sitting idle all the time. On the other hand, the very nature of the work is that they do have to kind of wait until something happens and then they respond. And so it's one that isn't an easy answer. There's no simple solutions in emergency services because you kind of have to be there, whether you need it or not, for the moment you need it, not for the all the time that you're not needed. So it's a challenge, but we're moving forward, and I think the council made the right decision, and we're going to start with Tillsonburg, beef it up a bit, and then we'll move on.
I have one question on this topic. You talk about the times. So what are the times now, if you know them, and what is the goal? So
the times in the urban areas are very good. Our average over the year is probably 7 to 8 minutes. 7.5 to 8.5 minutes, somewhere along that range. In the rural areas, we're probably looking at 10 to 20 minutes, and I think that becomes a concern, and it particularly becomes, the longer end of that duration. If the ambulances run into Woodstock to, do a call now, and then there's a call in a more rural area, it takes even longer. And I think that's the concern, that the 20 minutes we saw a few years ago, and then we kind of lowered it down, and now we're started seeing it start to creep back up. And so that's one of the reasons why we need to keep pushing for it. I think everyone, in the rural urban is slightly different, but I think most people are satisfied with the 7 to 8 minute for the urban area. I think we'd be much happier if we could see, kind of the 10 to 15 minute, probably kind of 10 to 12 minute range for the rural areas, realizing that that's one of the costs of living in a rural area, is that emergency services are always a little bit further away, and that's sort of one of the things you balance when you choose to live in a rural area.
Well, it sounds like there is some progress on this one.
I think so.
That is our time for today. Okay. Just like that, it just flew by. Thank you so much for joining me today.
Always happy to.
My thanks to Warden David Mayberry. I'm Sabrina Storm. Join us again for another edition of Web Chats.